Hello and welcome to this edition of Fact or Fiction. I'm your host, Pam Howard, and in our expert seat today is Dr. Michael Jennings, founder of Personal Family Physicians. Welcome, Dr. Jennings.
Thank you, Pam, and thanks to all of you for joining us. We'll help you sort through some of the confusing and conflicting health information found in the media.
As always, we welcome your questions and comments. Please send us an email. Let's get started with today's first topic. Winter months can be brutal on our skin, leaving us feeling chapped and itchy all over. So, what is the connection between winter and dry, itchy skin?
Well, you're right. The cold, dry winter air triggers a common condition that plagues a lot of people. Winter itch is a form of eczema, a chronic skin condition that tends to run in families. In colder weather, the skin gets dry, especially on the legs and hands. Dry skin leads to itch, which leads to scratching, which leads to the raised red bumps of winter eczema. The more you scratch, the worse it gets, and scratching may lead to an infection. There's no cure for eczema or winter itch, but you can take steps to protect your skin and decrease symptoms. First of all, moisturize your skin. This keeps the skin barrier intact. Moisturizing ointments and creams are heavier and more effective than lotions. Oils work well also. Apply these right after your bath or shower when the skin is still damp and at bedtime. For daytime, you can use something lighter and less greasy. Look for creams and lotions that contain hyaluronic acid, shea butter, avocado oil, or glycerin. Dimethicone, a silicone-based ingredient, works very well but can trigger acne breakouts. The skin on your hands has relatively fewer oil glands and tends to dry and crack easily. Alcohol-based sanitizers dry the skin more than good old soap and water, and they aren't as effective at killing viruses and bacteria. But soap is drying too and can irritate the skin. If you have very sensitive skin, use a gentle cleanser designed for sensitive skin. Carry a small bottle with you and use it instead of those scented soaps in public restrooms, which tend to irritate the skin. Deodorant soaps are very drying for anyone prone to winter itch. Use a milder soap such as Dove or Neutrogena. Take shorter showers and baths and decrease the water temperature. Long, hot baths strip more oils from the skin and leave you drier. If your skin is very sensitive, you can use a gentle facial cleanser for bathing. You don't have to lather up from head to foot. Just focus on the essential areas and give the rest of your skin a good rinse. Even slight decreases in air humidity are drying to the skin, so use a humidifier during the fall and winter. Whole house humidifiers should be set to maintain about 40 to 50% humidity. This will also help you breathe better and decrease other dry air problems, such as nosebleeds. Remember, when it comes to winter itch, it's very important to be proactive. If you take precautions before really cold weather sets in, you may have little or no winter itch at all.
Thanks for those helpful suggestions. That should help break the itch and scratch cycle. Now it's time for our viewer question of the week. This viewer wins a free 30-minute massage from our sponsor of this segment, Lisa D. Rossi at Hands of Change Massage. And here's our question. There are all sorts of calcium supplements on the market. How do I know if I should be taking one, and how much do I need?
We need calcium for many things, not just for strong bones and teeth. It's also essential for normal functioning of every cell in the body. In 2010, the Institute of Medicine reviewed over 1,000 studies and found the evidence supported a role for calcium and vitamin D in bone health, but not in other health conditions. Recommended daily intake for calcium, vitamin D, and other nutrients vary with age and are revised from time to time, reflecting the latest research. What's the role of vitamin D? It increases absorption of calcium from the gut and helps control its deposition in the bones. Vitamin D may be ingested or synthesized in the skin through sunlight exposure. Most North Americans get enough vitamin D from sun exposure, but older people living in institutions or those with dark skin pigmentation may not. The incidence of vitamin D deficiency may be overestimated because many labs use cut points that are much higher than recommended levels. Most Americans do not get enough calcium from food sources. Calcium supplements can fill the gap. The most common forms are calcium carbonate, calcium phosphate, and calcium citrate. These compounds contain different amounts of elemental calcium. Calcium supplements come in a wide range of preparations and strengths, and in combinations with vitamins and other minerals. Read the label carefully to determine proper dosage. Too much calcium can cause kidney stones, and very high levels of vitamin D damage kidneys and other tissues. The body easily absorbs most brand-name calcium products. Look for labels that have the USP symbol. Avoid supplements made from unrefined oyster shell, bone meal, or dolomite because they may contain high levels of lead or other toxic metals. You don't have to take calcium and vitamin D together or in the same preparation. Calcium carbonate is absorbed best when taken with food. Calcium citrate can be taken anytime. Divide your calcium into amounts of 500 milligrams or less per dose. Some calcium supplements may cause side effects such as gas or constipation. If one brand doesn't agree with you, try another form. Calcium supplements may interfere with absorption of other nutrients as well as over-the-counter and prescription medicines. Talk with your doctor or pharmacist about possible interactions between supplements and your medications.
Thanks for that answer. Our winner will be notified by email. Please send us your questions for future editions. We thank Lisa Rossi for sponsoring this segment. Let's take a fact or fiction test. We're told to drink 6 to 8 glasses of water per day. Some promote even more fluids, stating it clears toxins from our bodies. Tell us, is that a fact or is it fiction?
Water is an essential nutrient. We can't live without it. Water deprivation kills faster than lack of any other nutrient except oxygen. Each day, water losses from urination, breathing, perspiration, and fecal loss are balanced with water intake. The body has a sophisticated system that maintains water balance, and it seldom malfunctions in healthy individuals. There isn't a specific daily recommendation for water intake. An individual's needs are related to physical activity, age, state of health, body size, diet, and the climate in which they live. Under typical circumstances, adults may need up to 6 or 8 cups of fluid each day. Typical water output is 2 quarts or more each day. Urinary output accounts for about 3/4 of daily losses. Infrequent urination or strong, dark-colored urine may indicate you need more fluid. There's no advantage to drinking excessive amounts of water. In fact, it's possible to drink so much water that the electrolytes in your body are dangerously diluted, a hazardous condition called water intoxication, which can cause seizures, coma, and even death. So, to answer the question, yes, 6 to 8 8-ounce glasses of water per day is about right for an average adult in normal conditions. If you're unsure about what's right for you, ask your family doctor.
That's all the time we have for this edition of Fact or Fiction.
We really appreciate hearing from our viewers. Email your questions and comments to us and tell us what you'd like to hear about.
Join us again next time for another fun and informative look at current health issues. You can view previous editions of our show on our website.
Thanks for watching.
See you next week on Fact or Fiction.